Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist, and in the playlist I have provided almost all the topics in a very systematic order. This is quite convenient for the study. Hope you will make use of it. My dear friends, we have been discussing about adolescents care and Ayurveda perspectives in so many classes. Hopefully this will be the last class of this series. So, in the last class probably, so we will go to discuss about one of the very important problem during the adolescence period, that is suicidal tendency and as well as depression. Now, adolescence period is also the period of extreme stress, and it is also the period of extreme stress to the parents also. Now, stress in adolescence may be of various kinds, maybe academic stress, sports related stress, family stress, or maybe social stress or personal stress, anything. Personal stress in the sense there may be inferiority complex, bullying problems, and all those things, or body shaming, etc. Now, India consistently documents the highest suicidal rates in the world. If you see all over the world, India is one country which is always recording highest number of suicidal cases, which is very unfortunate. And majority of the suicides has been seen in the adolescents group. Now it is very disgusting that if 70% of the cases of suicides are very common in the adolescents group, where child is not, the person is not yet begun his life completely. So they are at high risk of committing the suicide because of their cognitive immaturity and increased impulsivity. When the studies are done on these aspects, it is found that increased impulsivity, which is seen in the adolescence period, and a cognitive immaturity is the most common cause. They have got the cognition is developing like anything, but there is an immaturity in its application, and that was found to be the most common cause for this. Now, prevalence of this depression among the Indians was 13.3. Depression is also one of the major cause of this suicide. Okay, 13.3 by using the patient health care questionnaires 9. This data was taken, and depression is the top class of illness and disability among the adolescents, and suicide is the third cause of the death. Completed suicides are higher in boys, and attempted suicides are higher in girls. One is completed suicide. Completed means he has decided to go for suicide and unfortunately completed it. That means successfully done it. So that type of tendency is more common in the boys when they go for it. Whereas when you talk about the girls, they most of the time go for committed suicides, attempted suicides, and many of the time they will be saved by the grace of the God. Now, life skill, what is the most common? That means suicide is a preventable cause of the death, isn't it? Suicide is a preventable cause of the death. Therefore, we have to think very seriously why this is happening in the adolescence period. Most common is depression, stress, love failure, and sexual relationship and immature relationship. Most of the time, sexual relationships, maybe the love affairs and all, where they will establish an immature relationship, and they think that itself is the life and it is inseparable, and all these consequences which will going to trigger it. Okay, that is also one of the most common. Depression is the most common. Similarly, even this immature relationships and immature love failure, love affairs, etc. is also one of the cause, and even immature, that means physical relationship leading to teen pregnancy or teenage pregnancy. So that is also one of the most common cause. Okay, before marriage, if they indulge in such a physical relationship and there will be a teenage pregnancy, so that is also one of the major causes. Anyway, all these causes are preventable. Okay, therefore we should be very serious on this. These are the preventable causes. Now, life skill education and building teens resilience, stress management, and a healthy media use and community awareness programs are very important part of prevention of the suicide. Now we will give more stress to the prevention. Okay, Okay, there are different issues because of this. The adolescents will going to commit the suicide. Now, how we can prevent it? Very important life skill education. That is very important. Okay, so what is happening in the society, how we have to lead the society, and these particular messages should be transferred to the kid right from the beginning itself. Okay, because at the time when he reaches the adolescence, he should have some basic idea of this. Okay, and how you have to behave, what may be the consequences. It is also the responsibility of the parents to time they have to tell. See, one of the major things that we have witnessed when we are in the childhood period is our parents used to discuss so many things in front of us intentionally. Nowadays we always think that don't discuss all these things in front of the kids, it will put a bad effect on the mind, psychologically and all we think. But see, I will give so practical our ancestors were, and they used to discuss some of the issues particularly in front of us intentionally. For example, if somebody is involved in what do you say, illegal love affairs and this all physical relationship and all, and if something bad happens, suppose एक घर का जो है एक लड़की है दूसरा लड़के से शादी किया, शादी करने के बाद दोनों भागे, और भागने के बाद जो है वो शादी की, और शादी करने के बाद कुछ नहीं मिला, उसके बाद जो है वो सुसाइड कर ली, है ना, कि माँ बाप का घर वापस नहीं आ पाए, इंसल्ट हो गया, सुसाइड कर ली. तो यूजुअली दिस इंसिडेंट इफ आई कोट दिस इंसिडेंट, they used to discuss these things in front of the kids, and we are also listening to them, and this create a sense of awareness in our mind in our childhood days. I do remember very clearly even today also. Okay, so that make a big impact, and that means in that particular childhood age itself we will have a mindset that no, this is a very bad thing and we should not do this, and this is the dangerous one and immature decision. So isn't it? So this type of education was given during the ancient times. Unfortunately nowadays it is missing. Okay, similarly any misbehave with the parents, that will be also discussed in those days. Okay, घर से बाहर डाल दिया बच्चे ने जो है अपना बाप को बाहर डाल दिया, तो इसका डिस्कशन खूब होता था, वो भी जानबूझ के होता था मैंने बच्चों के सामने. Okay, so this is one type of awareness program which our ancestors follow in a very very systematic way. Okay, so life skill education and building teens resilience, stress management, healthy media use. Now this is all media, social media is very very now vulnerable. Okay, um, ignitable also. So community awareness program, so this is required. Now symptoms of adolescent depression. What are the symptoms of adolescent depression? Persistent sadness and irritability, significant loss of interest in most of the regular activities, psychomotor agitation and retardation, fatigue and loss of energy, significant appetite or weight changes, feeling of worthlessness, impairment in the relationship with the friends and the family, academic impairments, and sleep disturbances, and suicide. So these are the symptoms of depression, adolescent depression, as mentioned in DSM-V 2013. How to manage this? Yes, psychotherapy, cognitive behavioral therapies, interpersonal therapy, and family therapy. Okay, we can name all these are the management principles, but how to do it applicable to the adolescents, that is important. That depends upon the skill and as well as common sense of the parents and as well as the doctor. Now, pharmacological therapy, if you want to give for this adolescents depression, a selective reuptake therapy inhibitors, fluoxetine and as well as mood stabilizers can be given. Building the life skills in the children and adolescents, and providing with the psychosocial support in schools and other community settings. 50% of all the HIV positive new infections are in the age of group 10 to 25 years. Very, very dangerous data. Okay, 50% of the HIV positive patients, that means new infections which is recorded, okay, identified. So the age group is 10 to 25 years. That means we are failing to give the proper sex education. Okay, our school, our colleges, our institutions are not at all taking any responsibility, because child will be or adolescents will be spending maximum time in the school. In spite of that, there is no any a setup or a fixed schedule, or what you say, programs aiming to prevent these particular activities in the universities or colleges or school. Okay, so although we know that most of the crimes they start from these areas only. Now, early sexual activity is not uncommon in India. Okay, so how to tackle this problem? In the first two videos I have explained how beautifully the brahmacharya palana and this early marriages, that is vivaha samskara and garbhadhana samskara, details I have explained that. So various biological, that is immaturity and incomplete estronized mucosa, that is various biological and psychological factors like lack of preparedness and lack of knowledge and unfamiliarity with the contraceptives, etc., makes the adolescent susceptible to these infections, HIV like infections. Okay, because that's a period of experimentation, curiosity and all, so they will go for this without any precautions. Now, vaginal discharge is common in girls and many signifies the physiological leukorrhea of the puberty, or at times suggests the endogenous or sexually transmitted infections. Of course, yes, there may be a leukorrhea during the adolescence period, but if it is not associated with the foul smell, definitely it is a physiological leukorrhea. But if it is associated with the bad smell and thickening or thick secretions and bad smell and all, definitely there is some infection is there, maybe bacterial or some other sexually transmitted disorders if they are involved in such activities. Now, the pelvic inflammatory disease is the spectrum of inflammatory disorder of the female genital tract, which is very common in this period. Salpingitis and other pelvic inflammatory disease. So these are all very common in the adolescence period as far as the female is concerned. Now, this can even present with abdominal pain and vaginal discharge. Now, talking about HIV and STD disorders, more than 2 billion adolescents are living with HIV today, and although HIV deaths are decreased in the last 8 years, the adolescents deaths are rising. Okay, now young people need to know how to protect themselves and how to and have the means to do it. Suppose if you're doing the intercourse and many other things, so how precautiously with you have to do it, so they should know it. This includes being able to obtain the condoms to prevent the sexual transmission of the virus and clean the needles and syringes of those who inject the drugs. Now, of course, first of all, we will discourage or we will not encourage all these activities, but if at all somebody is doing that, at least they should do with all the precautions. Otherwise he will be the victim of HIV and STD disorders in the adolescence period itself. Then his life will be totally miserable. Better access to HIV testing and counseling is also needed. Now, problem related to menstruation and menstrual hygiene, especially in the female, dysmenorrhea, premenstrual syndromes, irregular menstrual cycle, oligomenorrhea, these are the common things. Dysmenorrhea is common, about 67.2, and 63.1 will have the other symptoms related to premenstrual syndrome. Dysmenorrhea is defined as everybody knows, crampy lower abdominal pain related to menstrual flow, often accompanied by other biological symptoms including sweating, nausea, vomiting and diarrhea. This is the main reason for school missing, especially in adolescent girls, and daily routine of the girl will be totally affected due to prolonged bed rest and missed social activities, and also the commitments, academics, etc., and disturbed sleep and decreased appetites. Complications related to pregnancy. Now, early pregnancy and childbirth, this is one more problem, especially in the female adolescent girl. Complications related to pregnancy and the childbirth is the second most common cause of death for 15 to 19 years of the age globally. Every year, some 3 million girls aged about 15 to 19 will be undergoing the unsafe abortion. Babies born to the adolescent mothers face a substantially higher risk of dying than those born the women aged 20 to 24 years. It means to say that if the early pregnancy is there, the survival of the neonate is also very less. Unmarried adolescents are likely to resort to unsafe method of abortion. Now, the pregnancy occur without marriage, okay, in an adolescent girl. So then they will be hiddenly, they will go for some unsafe abortive methods to prevent the social problems, so which increase the risk of complications like septicemia and also the mortality. Adolescent pregnancy is also at increased risk of preeclampsia, preterm labor, prolonged and the obstructed labor, and the post-term hemorrhage. And such pregnancies are 2 to 4 times likely to die during the childbirth as compared to the adult pregnancies. Many girls who are pregnant will drop out the school. Newborn uh, born to such mothers will have the low birth weight or many times preterm with the risk of long-term effects. Now, what is the prevention? Reducing the marriage before the age of 18. Government is also made the law. Okay, now almost all these incidents are decreased to some extent. Creating the understanding and support to reduce the pregnancy before the age of 20. Even Ayurveda very clearly says that is, although the partner will be fixed in the earlier part, that is copulation or intercourse and planning for the child will be only after complete maturation of the GIT, that is after 16 years or 21 years for male and female. Now, increasing the use of contraception by the adolescents at the risk of unattended pregnancy, reducing the premarital sex among the adolescents, reducing the unsafe abortion, increasing the use of skilled antenatal, childbirth and postnatal care among the adolescents. Now, what is the role of pediatrician? If you look into the role of pediatrician in the whole context, pediatrician can be the right person to make the parents aware that child is growing and changing and you have to take care. Adolescents health programs are already available. Now, Kishori Shakti Yojana, we have already discussed it, to improve the health and nutritional status of the girls. Balika Samriddhi Yojana, to delay the age of marriage. Reproductive and child health program. Adolescents friendly health services. National AIDS control programs. Family life education. Beti Bachao and Beti Padhao Yojanas. So these are these programs are also giving its own contribution. What is the solution to a solution? Manage the adolescence period. Now, non-judgmental here will listen to you, but don't be judgmental to you and give any suggestion or correct you. Trust and acceptance, that is very important. Adolescents should trust you and accept you. You want respect and rapport, communication and safe space. Parents, family members come together and communicate. So that is also very, very important. Now, strategies for promotion of adolescents' health. Again, this can be remembered by the word adolescents. A stand for adoption of healthy lifestyle. D stand for development of appropriate strategy to discourage early marriage and teenage pregnancy. This is in nutshell, if you want to remember. Okay. O stand for organize the adolescents youth family clinic, youth friendly family clinic. Then L stand for life skill training and legal support. Then E stand for educate about the sexuality, safe sex, spirituality and responsibility. S stand for safe, secure and supportive environment to be provided. C stand for counseling, curriculum in the school, inclusive of family life education. E stand for enable and empower for responsible citizenship. N stand for networking for experience sharing. And T stand for training of income generation and teen clubs, etc. So with this, actually we have completed the adolescence period and its Ayurveda understanding. Hope this particular series is very, very helpful to you. Please visit my YouTube channel and also please give your valuable comments and please subscribe to the channel. Thank you very much. In the next classes, we will start with a new series of topic related to Komar Bhritya. Thank you very much.